Understanding hair loss and restoration is crucial, as hair loss is a common concern that affects millions of people worldwide. It can significantly impact self-esteem and cause emotional distress. Hair transplantation offers a solution. It is a surgical procedure that moves hair follicles from one part of the body to another to restore hair growth in areas of thinning or balding. Thanks to technological innovations, the procedure has advanced significantly, offering results that are not only natural-looking but also permanent. This essay will guide you through the process, explaining each step in detail. Hair transplants are sought after by both men and women, providing a permanent solution to hair loss. The procedure is safe and effective, but it is important to consult with a qualified surgeon to ensure the best possible outcome. Understanding the process can help you make an informed decision and empower you on your journey to hair restoration. The first step to a new you begins with a consultation with a qualified hair transplant surgeon. During this meeting, your medical history, including any history of hair loss in your family, will be reviewed. The surgeon will examine your scalp and assess the extent of your hair loss. They will discuss your goals and determine if you are a suitable candidate. They will explain the different techniques available and recommend the best approach for your individual needs. This is a good time to ask questions, address any concerns you may have, and understand the procedure in detail. The surgeon will outline the expected recovery time and discuss the potential risks and complications. Choosing a qualified and experienced surgeon is crucial, as a successful hair transplant requires not only technical skill but also artistry. Once you decide to proceed, preparation is key. Your surgeon will provide specific instructions which may include stopping certain medications and avoiding alcohol and smoking, as these substances can interfere with healing. You may be asked to wash your hair with a special shampoo to help reduce the risk of infection. On the day of the procedure, wear comfortable clothing that is easy to put on and take off to facilitate changing after the procedure. You should arrange for someone to drive you home, as you will be unable to drive yourself. The procedure is typically performed under local anesthesia, which numbs the scalp. You will be awake during the procedure but should not feel any pain. The surgeon will ensure you are comfortable throughout the process to help alleviate any anxiety. There are two main methods of hair transplant surgery: follicular unit extraction, or FUE, and follicular unit transplantation, or FUT. FUE involves extracting individual hair follicles using a small punch tool, which are then transplanted to the recipient area. FUT, on the other hand, involves removing a strip of scalp from the back of the head. The hair follicles are then dissected under a microscope and transplanted to the recipient area. Both FUE and FUT have their advantages and disadvantages. FUE leaves minimal scarring and is a good option for those who want to wear their hair short, while FUT allows for a larger number of grafts to be transplanted and is a good option for those with extensive hair loss. The choice of technique depends on the individual patient, and it is important to discuss these options with your surgeon. Section 5. Recipient site creation, placing the grafts. Once the hair follicles are extracted, the surgeon will prepare the recipient area. This involves making tiny incisions. These are made in the scalp where the hair will be transplanted. The incisions are strategically placed. This helps to create a natural-looking hairline. The surgeon will consider the angle and direction of hair growth. This ensures the transplanted hair blends in with the existing hair. The incisions are very small. They typically heal with minimal scarring. The number of incisions made depends on the number of grafts being transplanted. The surgeon will work meticulously. They want to ensure the grafts are placed evenly. This promotes optimal growth. The creation of recipient sites is a crucial step. It requires precision and artistry. It significantly impacts the final outcome of the procedure. The surgeon's skill in this area is paramount. Section 6. The art of transplantation: meticulous placement for natural results. After the recipient sites are created, the hair follicles are carefully transplanted. This is done using specialized instruments. These instruments ensure precise placement. The grafts are inserted into the incisions. This is done at the correct angle and depth. The surgeon will pay close attention to the direction of hair growth. This ensures the transplanted hair blends in seamlessly. It creates a natural-looking result. The transplantation process is meticulous and time-consuming. It requires patience and a steady hand. The surgeon will work diligently. They want to ensure each graft is placed correctly. This maximizes the chances of successful growth. The number of grafts transplanted varies. It depends on the extent of hair loss. It also depends on the patient's desired density. Section 7. Recovery and aftercare. Ensuring optimal healing and growth. After the procedure, your scalp may be tender. You may experience some swelling. These are normal side effects. They should subside within a few days. Your surgeon will provide you with detailed instructions. These instructions will cover post-operative care. This may include washing your hair gently. You may need to avoid certain activities. These activities include strenuous exercise and swimming. It is important to follow these instructions carefully. This promotes healing and minimizes the risk of complications. Your surgeon will schedule follow-up appointments. These appointments allow them to monitor your progress. They can address any concerns you may have. Most patients can return to work within a few days. It may take several months for the transplanted hair to start growing. Patience is key. The final results of the procedure may not be visible for up to a year. Section 8. Transformation and confidence life after a hair transplant. Hair transplantation can be life-changing. It can restore hair growth. It can improve appearance. This can have a profound impact on self-esteem and confidence. Many patients report feeling more confident. They feel more attractive after the procedure. This can lead to a more positive self-image. It can enhance their overall quality of life. Hair transplantation is a safe and effective procedure. It can provide a permanent solution to hair loss. The results are natural-looking. The procedure has a high success rate. If you are considering hair transplantation, consult with a qualified surgeon. They can help you determine if the procedure is right for you. They can guide you on your journey to hair restoration.